We are going to get started shortly. Okay. Well, this is our last speaker of the day. After Nicolle speaks, you will hear from Lanicia and we'll have some sort of closing remarks. But I am so excited to introduce Nicolle Fletcher. So Nicolle Sherry Fletcher lives in Conway, Arkansas, where she is the owner of Nurturing Arrows Doula Coaching Services, a business dedicated to providing doulas support, prenatal education, and support during the childbearing years. She is the co-founder, visionary, and executive director of Ujima Maternity Network, Inc., or UMN, a nonprofit in Arkansas. The mission of UMN is to work collectively to reduce the maternal and infant mortality and morbidity rates amongst Black and Brown mothers in the state of Arkansas through community outreach events, ethnically congruent doula support, lactation support, local resources, doula training, and midwifery care. Nicolle has dedicated her life to the advancement of maternal health care and advocacy as a certified birth doula for the past 14 years. Her professional portfolio includes becoming a certified lactation counselor, certified health coach, regenerative health coach, childbirth educator, trained postpartum doula, doula trainer and mentor, public speaker, and co-founder of City of Hope Outreach and apprentice midwife. Nicolle will be the first Black certified professional midwife since the Grand Midwives in Arkansas. In her years of service, she has trained and certified over 30 women as birth and postpartum doulas in Arkansas. Nicolle is an active member of the Arkansas Maternal Health Task Force, serves as the chair of the Arkansas Picori Maternal Health Advisory Board, and is passionate about being both in the community and the boardroom to affect lasting change in maternal health care and outcomes in Arkansas and beyond. So please join me in welcoming Nicolle.
There was a moment there I was like, I think I should start moving to the front. Thank you guys so much for having me. It is such an honor and a privilege to share this space with so many amazing organizations doing big work. And I was just kind of sharing with one of the previous speakers that it's awesome to see all of these pieces woven together, and you see what other organizations are doing around the nation, and their work is very similar. And the reason why the work is similar is because that's the work that needs to be done. That's the work that needs to be done. I'm a mover, so I'm gonna, if you don't mind, this standing here is not gonna work for me. Let me see if I get my little practice in on advanced sliding. How do I do that? Move it like that? Okay. Oh, go, okay. See, I needed just a little bit of practice. Work with me here. I feel like I'm doing too much. While they figure out how to get me right, I'm gonna let them do that. And then I just wanna talk a little bit about legacy. So what we've heard here is so much work, so much history of work. And then can you also show me how to click so I don't do that again? So much work and the legacy of your life. What do you leave behind? What is the message? What is the work? What is the impact that you want to leave behind? So for me, it has been like birth work. And I didn't even know it. I didn't even know that was a part of my heart, my passion, or my purpose at all. Had no clue, just kind of doing my life. I'll share the story of how I got into birth work. A friend of mine, I'm from California, a native of California, San Diego. We moved to Arkansas, and in our move to Arkansas, there was a woman, a friend, and she was having a home birth. And I was like, oh, you're having a what? You could have a home birth, you could have a baby at home. That's actually something that is available. And she was like, yes, watch me. And I was like, okay, I'll watch you. And after that experience, I was like determined, I'm going to be a midwife. Like, I'm going to be a midwife. I'm about to help these women do this thing. And what started as something kind of light. Let's just help people, like, ooh, this is fun. What started out as something light became something much deeper, became what was, what was mentioned earlier, became a call, became a purpose, became a passion, became a part of my legacy and my heritage that I will leave from my children and my children's children to come. It changed everything when I found out that mothers were dying needlessly. When I found out that there was bias and racism in maternal health care, when I found out that women felt like they weren't heard, weren't seen, weren't valued, weren't understood, when I heard those things, I had to answer the call. If not me, then who? If not now, then when? Were the questions that I asked myself before I stepped into this and I began to just move forward. So I started out as a doula. In 2009, I trained and became a doula, and that was the work that I was doing. And then I found out, again, I wanted to be a midwife when I first started, but started as a doula by the direction or instruction of a midwife that was in my city. I did that. I loved it. I loved that work, but I always wanted to be a midwife. And so I want to just share a little bit of this story that I haven't really shared on a public forum. I was told by a white midwife in my city that I should not pursue midwifery and that she would not train me as a midwife because she didn't want the competition. So as we stand right now in the state of Arkansas, there are no licensed or certified professional midwives. There are no CPMs in the state of Arkansas. Arkansas ranks #1 in maternal mortalities. Arkansas ranks #1 in maternal mortality. The Maternal Mortality Review Committee assessed that 92% of the deaths that took place were preventable. 92%. So there's part of that that is obviously disturbing, deeply disturbing, but there's a part of that that leaves hope. The part of it that leaves hope for me is that 92% didn't have to, so there's a solution out there. There's work that could be done and there is a solution. So we're not without hope. Okay, I'm gonna do this, I'm gonna do it. Boom! I did it, y'all. So I always want to talk about what is a doula, right? I always want to explain because a lot of people are confused. Sometimes they think doulas are midwives or midwives are doulas and they're interchangeable. They are not interchangeable. They are different people. They serve different purposes. So a doula is a non-medical essential, and I say essential, a non-medical essential support and advocate person for the expecting or postpartum woman and family. So she includes the entire family in her support, but she is essential. More often than not, her role or her presence is in the hospital setting. And I think the last speaker just mentioned that, where doulas can serve and support at home, but their role is really most impactful in the hospital setting. When a woman is in the throes of labor, she does not need to be seeking to advocate for herself. Like, what? Why are we even putting that on women? There's a lot of doulas around that are like, we do not advocate for you. We don't speak for you necessarily. However, advocacy is essential to the role of doulas. If you're not advocating, what are you doing? What are you doing? Building a relationship so that you can actually advocate, that's important. So you're not imposing your will or your ideas. You're building the relationship that is established with this family, and then you are sharing those with the medical community that won't have access to this woman beyond that moment. In her most vulnerable time, that's when she's introduced to all of these people. And I'm just gonna say this, in the hospital, typically, legs open, stirrups up, greet me at my vagina. That's great, right? And expect me to be open and relaxed. That's not how that works. So, yeah, I'm gonna skip next slide. Boom. Doulas in Arkansas. Doulas in Arkansas struggle to be seen as essential and valuable contributors to the maternal health care crisis. During the pandemic, you know, obviously healthcare declined. Maternal health care declined significantly. And it declined especially for Black mothers who were already at risk for morbidity and mortality. Doulas were not allowed to be present with their clients, inconsistent hospital policies and regulations, right? So one day I would be able to maybe go in with a client, and then the next day I wasn't able to go in because the new policy came down the pipeline and things changed. So again, there was a favoritism of certain types of patients over others. And that became an issue. So I'm had a client, it was a trans man who was planning a home birth, and that home birth ended in a transfer. And so transferred to a hospital, one of the local hospitals. And so he was able to have 6 support people in the hospital with him, right? Okay. The following week, I had a Black mother who I was not able to be in the hospital with. That's what I'm talking about. Everybody's kind of looking like, what, huh? Yes, that's what I'm talking about. So a favoring of a certain type of person over the other, but our statistics speak to the concern for Black mothers. This is where we're having the crisis. So while doulas in Arkansas, I feel like are extremely resilient and worked really hard. Doulas, I think, around the world, right? Super resilient, work really hard, fight for, let's make this happen and make it happen under the most extreme circumstances. Make it happen, right? We still have lots of work to do, increasing the increased barriers that cause it, that make it more difficult to receive this type of support and access with hospital systems, with doulas, just actually having access. Arkansas is also about 50% a maternal health care desert. So about 50% of the state lacks access to quality care or has low access. So that is a barrier in and of itself. And most of those areas are populated with African-American families, populated with like poor white families, low income families. And so that creates a barrier that exists in Arkansas. And I like to say we need obstetricians to include and encourage doula support for all of their patients, in particular the Black and brown ones seeking to navigate birthing in a hospital setting. This is not something that's happening in our state. Insert, Ujima Maternity Network. This is like my pride and joy, my heart, my love. This is what I like to call my 4th child. And so just a blessing that this organization has been. So again, most of what you guys have talked about, really, we're doing some of the same work. We're doing some of the same work. So I'm gonna, Ujima is a Swahili word, and it means collective work and responsibility, making the problems of my brother and sister my own and solving them together. So what is the problem that we see today? The problem we see today is maternal health care. So Ujima, collective work and responsibility, let's make this problem my own, own that myself, and let's work together to be a part of the solution. Let's be on the side of solutions rather than the side of problems. And how are we on the side of problems? I'm going to say 9 times out of 10, people are on the side of problems without even realizing they're on the side of problems. Okay. So when you're like, oh, you're so strong, you're so amazing, you got this, right? Or this is just the way we've always done it. You're on the side of problems. Step over to the side of solutions. And how do you do that? By working collectively. Again, Arkansas is in a maternal health care crisis. And to solve this crisis, all stakeholders, all of them, every single person that touches or connects with maternal health care has to work together. There has to be a collaboration. If there is no collaboration, there is no solution. There is no actual change. Everyone has to value what everyone else is bringing to the table as far as solutions. And once we do that, when we do that, we will see change. We will not be #1 in maternal mortality in the state of Arkansas. we will move that needle, but we have to work together. That takes humility. That takes humility. That takes stepping down from your pride of I am Dr. So-and-so and I am this whatever, to say, you know what? Doula over there, she's got some insight. She's got a pulse on the community that I don't have and I won't have. For whatever reason, I don't have it, I'm gonna connect with her. I'm gonna connect with that group and we're gonna link arms and be a part of the solution together. So about us. Ujima Maternity Network was co-founded by 7 Black birth professionals, doulas, under my vision in December of 2018 to increase visibility of Black doulas supporting Black mothers who expressed invisibility and poor maternal health care leading to birth dissatisfaction, increased complications, and needless morbidities and mortalities. Our founding members are Regina Chadden, Erica Davis, Nicolle Fletcher, Sarita Hendricks, Shakia Jackson, Shanika Reed, and Amber White. So what we do outreaches. So every second Saturday of every month, we do an outreach in our community. We call it maternal care community outreaches. Those are free to the community, and we usher women through what I like to call this maybe a parade, if you will. So they'll basically get to meet with myself, my colleague Sarita Hendricks, who is also an apprentice midwife and also a Black woman. They will get to meet with us, with our preceptors, but then have a midwifery model of care. So they will experience, whether they're birthing in the hospital or choosing a home birth, they will get the midwifery model of care. So they get 45 minutes to an hour of a prenatal versus the 5 to 10 minutes that they're typically used to. So we provide that type of support, walk through, ask questions, get to know them, and they get to know us. But more importantly, they get the empowerment to learn how to navigate the systems and what questions they should be asking and what support actually looks like. So we do that, and then they move over to the doula room. So in the doula room, our host of doulas are there, ready to meet and greet them with rebozo scarves and all the different things, birth balls and all of that. So they get to connect and provide physical support, teach them how to experience physical support during labor. Maybe you've got an ache and pain in your body. Well, and you're not necessarily in labor. How do I manage that just during my pregnancy? So these women will come together and help them. We also have certified lactation counselors. We do not have any IBCLCs for all of the reasons that were stated earlier, the barriers that exist. I don't know, I can't, thank you. I was like, I can't find the speaker that, thank you. So for all the reasons that exist, but those women now can then, if they're pregnant, they come and they talk about what they need for pregnancy, for breastfeeding during their pregnancy. So things that they need to get together or have resources that they need. So we'll provide that. If they're pregnant or if they've already delivered and they're nursing, they can get a breastfeeding assessment and work with them that way. So again, being available and providing that resource. What we're doing with our clinics currently, or outreaches, is we're moving throughout the state. We started those in February of 2001. No, excuse me, 2021. Got to add that too. It makes a difference, right? February of 2021 is when we started our outreaches. And this year is when we started to move that outreach to different parts of the state that are a part of the maternal health care desert. So we're really trying to get more mobile and get to the people, because again, transportation is another barrier. So we're trying to reduce the barriers. And by going to the communities where the people are, we feel like we can make a huge impact and a difference instead of forcing them to travel to where we are. So that's important. We train and mentor doulas. So we believe that community-based support is essential for all families, and having a strong social support leads to reduced mental distress, anxiety, postpartum depression, and improved outcomes. Doulas also need mentors and need therapy and additional support. So there's this big move. Let's bring doulas on. Let's get the doulas. Let's get the doulas. But then what? Who's caring about the doula? that's caring about the family, there is a weight, there is a stress, there is a burden that is also added to the doula when she is providing this care and this support. And I think that needs to be mentioned. That needs to be mentioned when we're addressing this. So advocacy, I think our advocacy, well, I know our advocacy is twofold. We advocate for doulas to be included in the maternal health care discussion and financial resource pool. Doulas need to be a part of the discussion. They can't be an afterthought. They need to be a part of the discussion because they are doing the work, that groundwork that the obstetrician is not doing, the nurse cannot do. Even the midwife, as great as midwifery care is and the change of that, when we go back to the older model, absolutely. The way the grand midwives functioned, absolutely. But the truth is, our current midwives aren't functioning the way our grand midwives did. So because of that, doulas need to be a part of the conversation and not an afterthought. We also need advocate for Black maternal women to experience safe, informed, and supportive birth experiences. Additionally, we have what we call the sister circle. So the sister circle is based on the centering model of care. The focus is to provide social emotional support and healthcare education without feeling clinical. So literally, each one of these tables that are sitting here, you could create your own sister circle and do that type of care. How are you feeling? What's going on socially, emotionally? What's your family dynamic? So this is the work that Ujima is doing in our community. This allows participants to feel truly safe, really, truly safe. So our values: collaboration, responsibility, community, and advocacy. Our vision basically is to reduce maternal morbidity and mortality in Arkansas by reclaiming birth autonomy for women of color through collective work and responsibility of the healthcare system, doulas, midwives of color, and community, and the communities most impacted by birth and birth-related mortalities. So it's really important just to kind of talk about this collective work. I mentioned it earlier, and I'm going to dig a little bit deeper. So some people say midwifery is the solution. Let's get the midwives back. So again, back to what the climate in Arkansas is. There are no Black, there are no Hispanic, there are no others other than white midwives in the state of Arkansas. So I just want you to sit with that for a second. That is challenging and that is a barrier. And I've spoken to some of the midwives, and one in particular, she said to me, well, we're midwives, and so it's fine. If they come to us, it's fine. I'm like, actually, if you've been a part of the healthcare system, the way that it has existed for the time that it has, and our numbers are continuing to climb, you're a part of the problem, especially if you don't change your practices. If you change your practices, yeah, you can step into the solution side of things. But generally speaking, you're a part of the problem. And the pride of, well, I'm a midwife, is the problem. Is the problem. So we're training doulas. Eventually, we train doulas, we train lactation counselors. We partner with other organizations to be able to do that training. We train doulas ourselves, but we also partner with other organizations to train our lactation counselors. So that's really exciting to be able to do that. Okay. Here's a video. Wait, can I stop it? Maybe just go back. Can I just? Okay, will the audio come? They need to be heard. Tell us your stories. Like, what has been your experience with different types? I remember, T, when you were pregnant and you came in, and how did you describe it? What did you say? I feel like hot trash on the side of the road on a hot Arkansas summer day.
I wasn't being heard. I'm not comfortable. I feel like I'm being dismissed. when I got to the hospital, it was a disarray of things that it was like the most chaotic time, you know, that you cannot plan for. I just didn't feel safe. And I didn't feel like I mattered at the time. If you're not seeing a therapist, are you not talking on social media? Who are you talking to? Whatever the stigma is, you don't go see a doctor about your mental health. You just fight through it. I was Googling, just different types of doulas and stuff. And there are postpartum doulas. One of the best definitions I was given is like, a doula is a pregnant woman's best friend. And, I was like, well, sign me up. We have seen women say, oh, I didn't tell my provider because they don't understand. Or I didn't tell my provider that I work 3 jobs and that might be why my blood pressure is high. Not a whole lot of white women know what goes on in my household. They don't know what it's like to walk in my shoes. And that's not because maybe they don't want to. They're not Black. They're not a Black woman. How does your pregnancy feel supported? And how does your postpartum feel supported? After I had the child, I thought I didn't see my baby for 2 days. My oldest son, he's 2 now, but when I had him, I was in the NICU for a week. They don't extend your lead time. After I had my baby, they want me to come back in 6 weeks. So after 4 weeks, I was like, I'm gonna start studying for my finals. And I could not study. Study and have this baby. If you would go to the doctor for anything else, you can go to the doctor for your brain. So you can go to the doctor for your well-being, for just your sanity. Even if it's nothing, at least just address it. Like, give me the medical information I need to ease my mind. And when your mind is even better, your body's better. I think, Yeah. My babies, they're so beautiful, they're gorgeous. But what about me?
What about me? What about me? That last mother, Tanisha Warmley, she is a medical mom. She calls a medical NICU mom. So she had her son who was born with kidney disease and has just been fighting that process. And so she has had more babies and had miscarriages and just a host of a story. But working through all of that and doing that alone, well, with her partner, but still generally alone, feeling like I need support, I need community. Where is the support? Where is the community? So Ujima has done everything that we can to step in to fill and be that role, and be that support to moms like Tanisha, to other moms, those moms that were all in the video that you got to see. And that was a sample of what our sister circle looks like. We were partnered with Every Mother Counts, and they did their film documentary, Giving Birth in America. They did the Arkansas edition. And so they came to Arkansas and partnered with Ujima and got to meet with some of our moms in our community. And this film was an amazing film to really just kind of talk about and highlight some of the concerns and some of the issues that we're seeing and really expose the work that's being done. So doulas are an effective yet underutilized resource and tool in improving maternal health care. Effective yet underutilized. You will go to the hospital sometimes and you might find somebody say, well, what's a doula? You still to this day find, what's a doula? We talked earlier about kind of like the bias that exists. And I like to share with people that think that they don't have bias or think that there's like an imposing of Black women are stronger, right? Or have thicker skin. And it's shown in this way. You're so strong. I don't know how you do that. You are so amazing. You are so strong. And in that is a subconscious and a conscious exchange of, oh, I must be stronger than everybody else. So it's twofold when we talk about personal responsibility. So collective work and responsibility. That responsibility is twofold. The onus of, no, I'm not that strong, actually. to correct some of the language that is gone out or that is communicated, correcting that and saying, you know what, I'm making it through. I'm making it through by the grace of God. I'm making it through by this, that, or the other. I'm making it through, but it's not that I'm extraordinarily strong or beyond your normal measure of a human. I have a human experience and I need support through my human experience. And that is the work that we're doing. So we have outreaches. This is one of my favorite pictures, this one here. This one, we did a demo. We just kind of like talked about resting. And for myself and Yejide, the mom in the purple, she was laid back on me. And what I realized in that moment is that she has not experienced rest. Because when she was laid on me and I'm holding her and putting this pulse here, she's still holding her own tension. She's still holding her own weight. So the process of just letting go, that's a process. That's a learning process that we each need to step into. But why and how do we learn to do that? We learn to do that when we feel safe, when we feel protected, when we know that someone else can actually bear the load that we have to unleash, right? So it was very interesting when we did that. It took about a good 5 minutes for her to, I was like, come on, I got you. I can feel, release, right? It took about 5 minutes to even get her to just let go enough. And I love this because we were using each other as support. And this is Ujima Maternity Network. This is what we do in our community. This is how we change maternal health care in the state. This is how. Linking arms, leaning, depending, and supporting one another. So this is just a visual of the bigger thing. So the obstetrician, the midwife, the doula, the community healthcare worker, all of these entities, the therapists, all of these entities coming together and leaning on one another. That's how we change. That's how we improve birth outcomes for every single human. For every single human, because it impacts every single person. It's not just the person that's giving birth. It's not just that person. It's the partner, it's the grandmother, it's the aunties, it's the uncles, it's the cousins, it's the children, it's the other children. It's everybody that's impacted when there's a mortality or there's a morbidity. Every single person around that touches that life is affected, and every single person around is responsible. So we births. This top one is just so great. This top center one here. One of our younger moms had a home birth and she rocked that sucker like nobody's business. She handled that. So it was beautiful. Kwaizi, we did our doula training just this past weekend. A couple weekends ago, we did a retreat training. So we went away to Hot Springs, and we had a retreat weekend. So the women got together, we did trainings, and in those trainings, we also got some hangout time, some pool time, all of that, beautiful. And then we provide lactation support. Let's see. So what doulas in Arkansas need? We need opportunity. We need OBs to recommend doula support in hospital settings. What was really nice to hear is some of the partnerships that you guys have established with the hospitals. And like, can we talk about that? Because that's what we need, is really to build some more of those partnerships so that OBs are recommending. We're still at the place of almost kind of territorial battle in the birth room. Right? We're still in that place. So Arkansas is a lot behind some of the other presenters today, and which is beautiful to hear and to see. So we know like, okay, there's hope. There's connection, there's possibilities. Okay, let me sit at your table. So if I've been like around you and being like, hey, let's talk a little bit, it's because for real, hey, let's talk a little bit, because we want to learn and we want to grow. We really want to make a change. Collaboration, again, like I said before, doulas need to be considered a part of the team and on the table, like on the table. Respect is huge. Respect is huge. As someone said earlier, if they don't listen to the patient, will they listen to the doula? Will they listen to the midwife? Again, back to humbling yourself to work collaboratively because you don't have all the answers. And to respect that woman, that family member, that person that's coming in and speaking about what's going on in their body, taking a pause to hear, taking the pause to hear, to connect, to resonate deeply with what's going on with the person. I like to describe this, and I spoke with an obstetrician, I think a couple weeks ago, and we were talking about bias and racism and different things. And I asked her, I said, hey, do you see this at your hospital? And she said, actually, I don't. And maybe she doesn't. But I would say, when you identify yourself as the majority, right? Whatever you are, whatever setting, there's a place and a time where I am the majority, depending upon where I'm at, okay? So if I identify as the majority, my colleagues are also all the majority. When I have a patient or someone come to me who is an other, who maybe financially isn't where I'm at, lifestyle isn't where I'm at, I look at them and I perceive them as an other. So there's an automatic difference. I'm treating you different because you are an other. But when I see you as myself, it changes. When I see myself in you, I'm more open. I'm like, yeah, I'll spend more time with you. I'll connect deeper with you because I see myself in you. And that's what we need to do. We need to work on seeing the humanity in one another, right? And that will change the way we care for our clients, our patients, whatever that is. That will change the statistical narrative. Compensation. So doulas are being compensated in other states, right? Not in Arkansas. Not in Arkansas. CPMs. So if a woman or a family is like, oh, I want to have a out of hospital birth. I don't know what it's like in other states. So if it's a thumbs up that's happening in your state, put a thumbs up. If it's a thumbs down, it's not happening. So insurances do not compensate for CPMs out of hospital birth. Thumbs down, thumbs down. Okay, thumbs down. So CPMs, back to the respect, right? So CPMs aren't respected even in the midwifery field. So I'm talking about things that people don't really want to talk about, but there's like, oh, there's a midwife. Oh, she's a CNM. She's a midwife. In Arkansas, CPM, certified professional midwives, are also identified by the state as lay licensed midwife. Did you hear what I just said? Lay licensed midwife. How you be a lay and be a licensed? How you be a lay and be a licensed? Those things don't work. But that's how midwives, CPMs in the state of Arkansas have to identify themselves once they take their state licensure. So anyways, compensation. The most successful states include doulas, both birth and postpartum in their funding, insurance, Medicaid, and extend those for the first year because we're still in the danger zone up to 12 months after delivery. So these are things that are important and things that need to change in the narrative that we need to move forward with. Oh, y'all. No, but I'm like right on time. Who's your girl? Thank you guys so much. If you have any questions, we can take them now. Yes.
I will come to you.
Thank you, Nicolle, so much for your presentation. Even though I fangirl over you, we go way back. My question is for your doulas, how do you help your doulas in regards to their mental health? Because I heard you talk about that, who's thinking about the doula? And what I know from my own experience here in the world or in the birth work world with doulas, there is so much trauma, both on the end of what the clients have their own trauma, but sometimes even the doulas themselves have had some sort of a traumatic experience, either in their own personal birth or just with the hospitals themselves. how do you emphasize to your doulas to take that self-care seriously?
That is an excellent question. So the first thing is we use one another. We connect with each other and we debrief, we process with each other. We have smaller groups where we connect and have conversations, but we also have outside, like, let's just kind of hang out and celebratory moments. But I feel like there needs to be more work with that. So we have some outlets, but I think having therapy and having that a part of our program needs to be something that is on the list, on the things. So we use one another at this point. We encourage therapy right now. Moving forward, we would like to be able to have that as a part of what's available to our doulas. So again, I feel like from the conversations in the room, I feel like we're very much a baby organization, very much in our infancy. And so part of that is like funding to cover and care for doulas. So Ujima Maternity Network needs funding. We are a 501c3 nonprofit, and you may donate. You may donate in any capacity. You may donate specifically to fund a doula, a community member to have a doula. You may also fund doula training, someone to be trained as a doula. You may also fund midwifery. You may also fund travel expenses for us to go to these places and meet these moms. You can donate today. So, oh my gosh. You can also, so we are not at the place of having doulas on staff through Ujima. So all of the doulas are coming through, they're volunteering. So they're volunteering their time and their service, and then they're hired outside. So for example, let's say you were a doula client, you came through our maternal care community outreach, that is free, and you wanted to have a doula support from somebody that you met that day. You and that doula would then contract and you would have support that way. So we provide like the wheelhouse of here's where the resources of Black doulas are. This is our Black doula meet group. And then you go off from there. But some of the issues and some of the reasons why people aren't using doulas is because financial barriers. So yes, yes. Oh,
Oh, I was just gonna say, I wanted to, after everyone spoke today, I wanted to get on the mic and just chat with all of you, but we're gonna have tonight at the, afterwards, the event tonight to speak more. Like you said, these are my people, you're speaking my language, it's amazing, and I wanna do a tour. I want us to all be able to go visit and go to each place and meet each other where we're at, and like you said, learn from each other. It's incredible. And when we started, we were totally volunteer doula support. So we were doing it for free for years until we had enough grant funding built up and returning grants. And Lena, who's not here, she's our grant writer who's incredible. She says, even without the money, we'd keep doing it because this is our heart work and this is what we love to do. But we started doing this for free, and now we're able to pay doulas through our org. So it's amazing to see where everyone, and like we're learning from each other. It's incredible. So just thank you so much.
when you were talking, I wanted to just say, started from the bottom, now we're here.
I'm in the back, it's hard to see. So good afternoon. My name is Erica Taylor Murph. I'm actually with the city of Kansas City, Missouri. I work out of our Kansas City Health Department. And so when you had mentioned around funding doulas, I'm just going to brag on my city a little bit. Welcome to Kansas City, those of you who are not from here. But one thing that I really respect that we're doing as a city is being very innovative with some of our city funding. So we at the health department have had the opportunity to really receive additional city funding to work with Black maternal health in Kansas City, to where the money comes through the health department and we can in essence contract with Black maternal health organizations, those who have doulas, to where they can use that money to pay their doulas. So just another, I hear different cities in the room, but maybe opportunities to have like with, you know, your mayor, your city manager to talk about how can we just start to maybe funnel funds through our local health department or however it makes sense to. Just another way to be creative if that's helpful. So I just wanted to share that with a heart of service.
Beautiful, thank you.
I'll come to Ginger. I want to make sure the Zoom people get their time in the sunshine. Okay, so two questions I want to read out. Are there any events coming up for Ujima that we can support this last quarter of this year?
Yes, so we have our maternal care community outreach will be October 14th in Pine Bluff. We're partnered with an organization called Future Builders. We will have another one in November and in December. So every second Saturday of the month, we'll be doing those outreaches. In October, Pine Bluff. In November, we'll be in Lone Oak. And in December, we'll be back in Conway. December 28th is Ujima Day. It's the Kwanzaa principle. So December 28th, we'll celebrate all of our doula trainees. We'll have a celebration for them and also celebration for myself and my colleague Sarita Hendricks as midwives.
Yeah. Okay, other two things I want to read are actually more stories versus questions. The first one was asked before you explained your apprenticeship, so sort of asked if you were apprenticing, but Layla said you should apprentice to become a midwife. Nicolle, the writer, I was told you're too fat to be a midwife. You can't counsel about good nutrition when you don't eat well, by a white CPM.
I just have mouth open for that. Like, wow.
Yep.
I'm sorry that is your experience. And the truth is, if that's what you want to do, pursue that. And don't let anyone stop you from pursuing what is your God-given right to do and will change the trajectory of healthcare for maternal women. Like, don't let the naysayers stop you. Just let them watch you.
Yeah. Okay, the next little nice thing. Quentin and Tanisha Wormley said, I am so thankful for Ujima community. I feel supported with postpartum, being a mom of 3 under 6 with 1 medically complex. Ujima provided an outlet for me to breathe and hold space for me outside of motherhood. Around.
Hi, everyone. I'm Mustasia. I'm a midwife from Iowa. Since we're talking about funding doula projects, I just wanted to talk about a couple of the things that are happening in Iowa, just to give you a few more ideas. So I was one of the advisors on a project that our Title V state office did to train Black doulas in Iowa. So last I heard, we had trained like over 50 Black doulas in Iowa. So all that was paid for through Title V block grant funding. So that's something you can look into. Because that pilot was so successful, some of our Medicaid MCOs are helping to support the training now. And what was the other thing? Oh yeah, just this week, my county, I'm from Iowa City, Johnson County, Iowa is using their ARPA funds. So that's the American Rescue Plan funds to pay for doulas to be trained and support moms in Johnson County. So
Beautiful.
other options.
Thank you.
On what Lastasia said, and you and I need to talk tonight if you're coming. If not,
I am.
we need to get on the phone.
I am.
There are some major investors in the state of Arkansas who I think you probably know who I'm mentioning, one being the Walton family. And there's another one out there. If you have not connected with the major funders in Arkansas, I am willing to make that connection with you. And you have a story that needs to be polled at the highest level of the philanthropic people in that state. And I'm curious if they've opened the doors to you yet. The Walton sisters in particular that run the foundation.
So through the film, through Every Mother Counts is how I was able to sit at a table, but that's what happened. I sat at the table, shared a little bit, and would need
Yeah.
to do, there's more.
Yeah, there's more.
I just wanted to suggest, I just sat on a board meeting with this, I'm from Kansas. I just launched, well, earlier this year, Delia, who was back here, she's already gone, and another doula who's from Missouri. We launched a pilot program through the state of Kansas with United Healthcare to provide free doula services for Black moms of KCK. So I just sat on a board meeting for Missouri. So I'm gonna give you this doula network information. It's one of the agencies that are paying doulas through Medicaid. And Medicaid is really, I think when I became a doula, it was just like Oregon, and it was like 2 states that covered it. Now it's expanding. And so I'd be more than happy to help you. I was on the campaign last year for the first Black judge in KCK. I was her treasurer. And she's backing me up with everything that I have a meeting October 15th with some legislators in KCK. But the political world, you gotta kind of dab in that. So, yeah.
Thank you. Y'all, I'm loving all the tips.
Hey.
The
While I
next time,
walk
yeah,
in-
the next time I come back, I'm gonna be like, y'all, we funded to do everything, everything.
Great.
Thank you.
Thank you.